I went into orthopedic surgery because I love to build things. When I was a kid, I'd build model airplanes. A model airplane is something that is really an elegant balance between form and function. And you want this thing to fly, and if you make it too heavy, it doesn't fly very well. My expectations for patients before surgery center primarily around education. I want an educated patient. I want a patient that's knowledgeable about the care that they're about to receive and the surgery they're about to have. I find that an educated patient is someone who can make a good decision about what will help them and make them feel better, and also will help them understand the process of surgery as they go through it. My favorite part about orthopedic surgery, the creativity that's required in a set amount of time. That's in the operative theater. Decisions that are made in a very finite amount of time, and outcomes reflect that. And so I do enjoy the challenging environment that surgery is. I also very much enjoy the interaction that I get to have with patients as a physician. And there is a lot of orthopedic need, and so a lot of orthopedic problems. Very few subspecialties in medicine get to help cure the disease as effectively as orthopedics. A bone broken, arthritis present in a knee, a surgery, or even sometimes conservative treatment will resolve that problem completely. That's very satisfying as a physician to see a patient and see them go from hurting and not performing well or functioning well to healed and feeling much better. One of the most incredible advancements that we've had, that we've seen even in the last couple of months and years, is the issues of pain management around the time of surgery. A total hip would stay in the hospital anywhere from 3 to 4 days. Managing pain more effectively now with a multimodal pain approach, I'm finding that patients stay in the hospital a day, sometimes go home even the day of surgery. As a general orthopedic surgeon, I take care of issues that range the full spectrum. My subspecialty interest in total joint replacement has been something that I have brought to Coeur. I enjoy hip replacement, knee replacement, and also total shoulder replacement. Revision surgery I find challenging, and I enjoy that as well. I use the anterior approach with hip replacement. Some of the benefits of the anterior approach are that it is a muscle-sparing surgery. So when you approach the femur from the front or the anterior direction, you're able to go between muscle intervals that exist normally in the human body. This allows you to do the hip replacement without detaching those muscles from the bones. When you do that, you have a decreased risk of limp. You can get the leg length more accurately, and the risk of dislocation is also significantly reduced. For each of these reasons, I find the direct anterior approach to be very beneficial for a certain patient subset. Accessibility is a big deal for me, and I feel that patients need to be able to get in to see their physician if they have questions or they have issues with their or an orthopedic complaint. One of the ways that we do that is I work closely with mid-levels or advanced practice professionals. That's a physician assistant or a nurse practitioner. We have both in this clinic, and this allows, if you were to call in and say, I sprained my wrist, or I broke my hand, or I broke my ankle yesterday, we can get you in within a day or two. And that's really important. I believe access to care is actually probably the fundamental issue that we deal with, other than being able to communicate the diagnosis effectively with the patient. The promises that I can deliver on as a physician for you are, one, I'll always be honest with you, and two, I won't abandon you. And those two things, coupled with an understanding of the relationship that you have, really the foundation of that relationship, makes for happy patients.